U.S. coronavirus infections and deaths have fallen to the lowest level seen in nearly a year. Daily cases are now under 30,000, and the daily death toll is below 1,000. Meanwhile, nearly half of the U.S. population has had at least one dose of a coronavirus vaccine, and nearly 40% is fully vaccinated. The latest numbers come as states take new steps toward normalcy. New Jersey is set to lift its mask mandate for most indoor places just in time for Memorial Day. And New York City is set to fully resume in-person learning. But as Mola Lenghi shows us, classrooms will look a little different this fall.
Well, students will be back in the classroom at public schools like this one here in New York City this fall. They'll be in person. Now, right now, more than 60% of the city's students are learning remotely.
Tonight, there's another sign of life returning to normal. The nation's largest school district, with more than 1 million students, will end remote learning beginning this fall.
Every single child will be back in the classroom.
As districts nationwide return to in-person learning, more parents can get back to work, helping the economy recover.
This is going to be crucial for families. So many parents are relieved, I know, and it's also going to help us move this whole city forward.
The news comes as nearly half of the country's adults are now fully vaccinated, and the number of COVID cases in children fell for a second straight week. A small study has found that most children who suffer from MIS-C, a rare post-COVID syndrome where different body parts become inflamed, recover after about 6 months. But the CDC is investigating several dozen reports of inflammation of the lining of the heart in teenagers who received either the Pfizer or Moderna vaccines.
Fortunately, they seem to be rare cases. Right now, we do not know if it's related to the vaccine. It's potentially possible.
Is it something parents should be concerned about?
Well, I mean, something that needs to be followed. I would still move ahead with vaccinating.
And tonight, vaccine clinical trials continue for children under 12. Andel, 3, and 8-month-old Soren Good were given 1/10 of an adult dose.
Yeah, we'll take the vaccine any day over the potential downsides of COVID.
With vaccination records being set, so are travel records. With Memorial Day weekend just a week away, planes are 90% full again. Elaine?
Mola Lenghi, thank you. For more, let's bring in Dr. Ebony Jade Hilton. She's the co-founder and medical director of Goodstock Consulting and an associate professor of anesthesiology and critical care medicine at the University of Virginia. Doctor, welcome. Thanks very much for joining us. As we just heard, Mayor Bill de Blasio announced all New York City schools will fully return to in-person learning in September. Masks will be required. Doctor, what does the science tell us? Are schools in a position to put a complete end to virtual learning? And what would you say to parents who may be hesitant about this plan?
Right. What I would tell the nation is just to be patient. What we know is that this pandemic has shown us, but when we draw a line in the sand, it moves the goalposts, right? And what we know, even in New York City, they've done a fantastic job in the Northeast of vaccinating patients, but we know that's not shared equally. For instance, Cypress Hill, 28% fully vaccinated, which is also 96% minority population. But look at Breezy Point. Breezy Point, 67% fully vaccinated, of which the majority of persons living there are white Americans. So we see there's a divide even within a city that's doing well. And we're seeing the same thing across the country from Northeast versus the South.
It's really important to note those disparities like you just did, in a place like the New York City area. Well, we also heard the CDC is investigating several reports of vaccinated teens and young adults suffering from myocarditis and inflammation of the heart muscle. What more do we know about this? Should parents be concerned?
Yes, so myocarditis, what we know is that in general, before COVID, about 10 to 20 out of every 100,000 persons would develop myocarditis. So it's inflammation around the heart. Now, we can't say it's a big difference between causation and correlation, right? Does the vaccine necessarily cause this myocarditis, or would they have developed this in general? Now, what we do know for sure, though, is that COVID-19 itself is linked to myocarditis. And we can look at the athletes out of University of Pennsylvania, the student athletes. What they show is that even those with mild to asymptomatic COVID-19, about 15% of them develop myocarditis, right? So we're going to see these cases, and what is our duty, our job is to see what is the causation, is it linked, and if so, take the appropriate precautions.
Well, the former head of the FDA, Dr. Scott Gottlieb, says Americans should make, quote, individual assessments of the risks when deciding when and where to use a face mask. He also says people can't be relying on public health mandates to protect themselves. Doctor, what's your take on this? Could this approach ultimately cause more mask confusion?
Right. You know, I tell people always err on the side of being safest for you and your family. What we know is that 3 to 4% of Americans are actually immunocompromised, right? Those persons are going to be at risk of having some serious side effects if they do contract COVID-19. What we know is that we do have breakthrough cases, even if you are vaccinated, that you can still become infected with COVID-19. So in this time that we have this mismatch of who's getting vaccinated, who's not. In this time of it's warming up and people are going to be traveling a lot more, going down south of where we have some vaccination rates of only 30 to 40% in Mississippi, Alabama, South Carolina, Georgia. When you're doing all these traveling, you just have to keep in mind that not everyone has been vaccinated, that COVID-19 has not gone away, that variants are increasing, and that currently, unfortunately, although our cases are down 24%, we are still burying 550 people per day. We have to remain vigilant.
Well, Doctor, let's turn to what's happening globally. India has surpassed 300,000 coronavirus deaths. That is the third highest death toll in the world. Aside from the virus, the nation is also battling a fatal fungal infection known as black fungus. What is India's way out of the second wave?
Right. I think India's way and truly our global response has to be vaccination. You know, right now, America, we have about 70 million vaccines in stockpile. We're estimating we're going to have upwards of 300 million by this summer. And so in thinking of how do we stop this virus, how do we stay ahead of the variants that have potential to develop, it's through vaccinations. And we know right now there's a disparity. The wealthiest countries, they have the most vaccines, and the poorest countries, they do not, including 12 countries within Africa that are a complete vaccine desert without any vaccines being administered there. If we do not have this global approach, we can see a pandemic within a pandemic. And so, yeah, I think we're going to see with the Biden administration some release of those vaccines to those areas that are most needed.
All right, Dr. Ebony Jade Hilton, thanks very much for sharing your insight with us. We really appreciate it.
Thank you.